Good afternoon, everyone. On the behalf of Cardiology Division from Alembic, I warmly welcome participants today to today's
Three,
Volume Matters
two,
webinar.
one. We are live now, sir.
Okay. Good morning, everyone. On behalf of Cardiology Division from Alembic, I warmly welcome participants to today's Volume Matters webinar. Today's topic is lifestyle tips in hypertension management. Now, I am pleased to introduce our speaker, Dr. Naresh Sharma, sir, who will guide us on simple and practical lifestyle measures for better BP control. Thank you, sir, for joining us today. Over to you, sir, now.
Good afternoon, friends. Today we will discuss what hypertension or high blood pressure is all about. As we are celebrating, this is a hypertension week. So, as we are celebrating today the hypertension day, and we will discuss what high blood pressure or hypertension is all about. What is blood pressure? Blood pressure has two components. One is called systolic blood pressure, and the other one is called diastolic blood pressure. Systolic blood pressure is the upper one, which means that when the heart pumps out the blood from the left ventricle, the pressure in the arteries rises. That is called systolic blood pressure. When the heart relaxes, then the pressure falls in the arteries. That is called the diastolic blood pressure. So systolic and diastolic pressure should both be normal. So now we will discuss how this happens and what we can do. So how we can understand that how the volume and the blood pressure changes, they matter and interrelated with each other. So excess salt intake increases body fluid volume and putting extra strain on the heart and leading to high blood pressure. What is excess salt? Excess of the normal salt which we take in our food, or the extra salt which we take in snacks and other, what happens? It leads to the retention of fluid in our blood vessels or arteries, and that it increases the blood volume. So the total blood volume in the body is increased. So what happens? There is a resistance to the pumping action of the heart, and then the heart has to pump and apply more pressure. So ultimately, the wall of the left ventricle or the heart walls, they become more harder, thick, and brittle. So that is high blood pressure. But how it happens? So basically, we call high blood pressure if the systolic blood pressure is more than 140 and the diastolic is more than 90. So that is the definition of the high blood pressure. So the first carry-home message is that controlling salt intake and body fluid volume is key to protecting your heart and managing the high blood pressure. So what are the targets of high blood pressure which we want to maintain a normal blood pressure? So basically, in adults, the blood pressure should remain at the level of 120/78, but we can't maintain that. There is an average blood pressure. This is an average blood pressure, but the distance between the high and low should be around 40 millimeter of the mercury. So in patients with diabetes and CKD, and in patients with cardiovascular disease, we want to lower the blood pressure further. So in systolic blood pressure, in these patients having these morbidities, comorbidities should be 120 to 129, and the diastolic should be between 70 to 79. So if you have high blood pressure, if your blood pressure is above this range, then always consult a physician or your doctor to control it. Because if you will measure the blood pressure in 10 adults, and out of the 10 you will find that 4 to 5 adults, they have the high blood pressure, and most of the patients, they are in denial mode. They don't accept that they have high blood pressure, and they keep on moving in the society and keep on moving doing their work with high blood pressure. And the patients mostly who don't have any symptom of high blood pressure, they are the most dangerous patients, and someday they land into some severe complication due to high blood pressure, and they land into an emergency. So these are the patients whom we have to take care. So what the DASH diet is all about, and what are the dietary approaches we should follow to having our lower our blood pressure. The dash diet means eat more fruits, and you should be choosy as far as the fats are concerned. Low fat diet, low fishery products, low poultry products, and the good source of proteins are the healthy fats. So cut down your starch, cut down meat, cut down sugary drinks and sugary foods, and they ultimately lead to the cut down in the calories. And go for enough fruits, like having potassium rich fruits like banana and other cereals and other vegetables. So adopting the DASH diet every day is a simple and effective way to manage high blood pressure and protect your heart. And the ultimately, the thing which we have to follow in our daily routine is reduction in the salt intake. If you will reduce salt intake, ultimately you will give relaxation to your kidneys. So what happens? High salt intake means you will have more water in your blood vessels. There is expansion of the blood volume, and this high salt kidneys have to excrete it. As the age progresses, kidneys they become unable or they have low capacity to excrete this high salt. So ultimately, patient lands into high blood pressure. So less salt intake leads to the healthier heart tomorrow. So we have to follow. This is a very important point, and we have to change our lifestyle. It is very important. What is lifestyle? Go for daily walking, jogging, aerobic exercise for 30 minutes. What the American Diabetic Association says that every person should go for 45 minutes daily walk, brisk walk for 5 days a week. That is the recommended way of doing exercise. Then even if you want to keep your mind cool and calm, yoga helps a lot. It reduces stress. Then meditations, calmness is the other key to make your brain cool and calm and manage stress, and that will ultimately lead to control of your blood pressure and the reduction of the high blood pressure. So gut health should be normal and should be you have a very healthy gut. And what will make your gut healthy? Eat more fiber from fruits, vegetables, and whole grains. Increase yogurt and probiotics in your diet. Add prebiotics and probiotics rich foods like banana and other cereals, and even this onion and other things. Cut down processed foods, excess salt, saturated fat, and excess starchy foods. So if you would take care of your gut, ultimately you will have a normal blood pressure. So your other addiction should be managed also. Avoid alcohol, avoid smoking, and avoid other energy drinks. Follow lifestyle changes with prescribed medicines. If you, after following all the disciplined life and managing your lifestyle, if you don't get improvement or the lower your blood pressure, then go for a physician and get your medications and get your blood pressure reduced to the normal levels. Then limit your sugary drinks and caffeinated drinks also. So what the carry home message is all about? Carry home message is change your lifestyle to a normal healthy lifestyle. Go for regular walk for 45 minutes for 5 days a week. Eat healthy, cut down your fatty drinks, cut down your fats, and cut down starch, cut down sugars. Eat healthy, potassium rich fruits and fiber, and go for your yoga and other mind exercises to keep cool. Ultimately, all these methods lead to the lowering of your blood pressure and a healthy heart, healthy kidneys, and healthy lifestyle. So that is the carry home message. Thank you.
Thank you, sir, for this informative session, sir. We will now begin the question and answer session, sir. Now participants can share their question in the chat box, and I will read them and out for the record. Please. So, sir, we have some questions, sir. First question is, sir, can I stop BP machines after my BP become normal? BP medicine, sorry.
BP medicines
Medicines after my
can
BP
only
become.
be stopped after you get a continuously normal BP reading for 6 months or so without medicines. Otherwise, BP medicines, you should reduce the quantity of BP medicines and then follow the instructions of your consulting physician, and
Okay,
follow
sir.
the healthy lifestyle. That is more important to control your BP.
So second question is tea or coffee harmful for patients with hypertension?
Yes, moderation in the consumption of tea and coffee is very important to control the high blood pressure.
Okay, sir. So next question is this again the same question. Now we will take next. Once my BP is becoming normal, okay, can I stop
This is,
medicine? This is the same question, sir. What food should I avoid, sir?
in the food, we should avoid sugary foods. All we should cut down sugars, increase the fruits intake. We should stop or moderation in the alcohol intake, quit smoking, and eat more fruits which are rich in minerals and elements. And in the diet, in the especially in the cereals, we should cut down the whole cereals.
Okay, sir. Sir, next question is how much salt is safe for me in a day?
The recommended dose of the salt intake is approximately 5 grams per day. 5 grams
Okay.
means there are the measurable spoons present in the home, or there are you can get in the market that it's 5 gram is the upper limit. So what the idea is all about, we should take whatever salt present in our daily vegetables or we consume in our routine. We should not take extra snacks, extra these salty materials, salty drinks, extra. So we have to avoid all this. Otherwise, there will be salt load in the body, and ultimately BP won't come to normal.
Thank you, sir. Uh, so next question is what is the right time to measure your BP during the day?
BP should be measured early in the morning before breakfast and approximately in the evening around about 7 p.m.
Okay. And what is the best time for exercise?
There's no best time for exercise. Whenever a person finds time, maybe in the morning, maybe in the evening, whenever, at what time, maybe you have to spend 45 minutes or 1 hour on your body. So there's no time. At any time, whenever one finds time, one can go for exercise and one can go for any exercise of his choice.
So there is one more question. Does stress and tension really increase blood pressure?
Yes, stress and tension are the male culprits in the etiology of the hypertension. So if you able to calm your mind, do yoga, you do other mind exercises, and try to live stress-free life, then definitely, even without medications, sometimes your medication they get very on the lower end, you can get relief of your hypertension or high blood pressure.
Okay. So question is, sir, when I am on a daily diet and good exercise, my BP becomes normal. But when I took protein shake, my BP shoots up. What आगे ये क्वेश्चन है सर उनका कि इससे हम क्या कर सकते हैं? How we can control this?
These protein shakes, they must be containing lot of sugars also, and must be lot of salt also. So high these sugars and high salt diets, they ultimately land your BP on the higher side. So we will have to avoid, we have to moderate our these drinks, these soft drinks.
Okay. Sir, there is a last question. Sir, in my case, 90% of the time, I did not get any symptoms when my BP is high. Mostly of the time, I not get any symptoms. मतलब means कि वो उसको symptoms नहीं है, but they are having high BP. तो how they can manage that?
Let me clear one thing.
Hmm.
High blood pressure, most of the patients, they have headache, they have dizziness, they have cloudiness of their brain, they have less attentiveness, they become less alert, and sometimes they have difficulty in walking. These are the normal symptoms in a high blood pressure patients. And these are the patients who we call good patients. And these patients, they immediately, when they get these symptoms, they immediately get and go for their treatment. But the other group of the patients who keep on moving with the BP of maybe 180 to 120 or more than 200 systolic blood pressure, and this group of patients, sometimes they don't have any symptoms. They are symptomless, and someday accidentally they get their BP checked and they find it is more than that those dangerous level. So one thing is very important. It is this group of patients who are the dangerous patients, who are always at the risk of entering into some cerebral stroke, or maybe some myocardic infarction or heart stroke, or ultimately damage their kidneys. You know, BP is a slow killer of your body organs. It slowly kills your kidneys, slowly kills your heart, it slowly damages your brain. So these are slow killers, and patients who don't have any symptoms, they get damaged these organs very early, unknowingly. So whenever you find the BP on the higher side on successive or repeated measurements, go for treatment. Immediately go for treatment and keep on following the treatment and keep on following the guidelines by your doctor, because maintaining your BP within the normal range is very important.
Thank you, sir. Sir, there is one more question. What is the correct time for checking BP at home? What is the best time for
We have
checking our blood pressure?
already told that around about 7 p.m. in the evening is the very right time. In the
7
evening,
p.m. Okay, sir.
PM,
Okay.
in the evening, because most of the patients, they get time only in the evening to get their BP check at home. I mean home monitoring.
Sir, there is a question. Is it a genetic disease?
Yes, to some extent. To some extent, it is genetic, but
Okay.
other factors like lifestyle, dietary habits, your work culture, all they lead to the high blood pressure.
Okay. सर एक लास्ट क्वेश्चन था कि एक पेशेंट का आया मेरे को कि जैसे सर्दियों के दिन में मेरा बीपी हाई रहता है लेकिन गर्मियों में मेरा कंट्रोल हो जाता है और क्या उस केस में मेरे को गर्मियों में भी दवाई खानी चाहिए क्योंकि दवाई खाने के बाद मेरे को लो फील होता है.
It is not a common thing we usually see in the patients. Maybe some other reason that he may be sweating more in the summers and have normal BP, or
Okay.
in the usually in the winters there is no sweating and his BP may remain in the normal range. So the good thing is that he should follow, he should restrict his salt intake, particularly in the winters. He must be taking more salt in the winter. So his blood pressure must be salt sensitive.
Okay. सर एक लास्ट क्वेश्चन है कि इफ इट्स अ जेनेटिक देन कैन आई कंट्रोल माय बीपी विद चेंजिंग माय लाइफस्टाइल.
Initially, every patient should try to control his lifestyle. Then the first chance should be given to your lifestyle changes. If it is not possible, even then you are getting high BP on the higher range, then go for the medications.
Okay. Okay, sir. So there is no question left, sir. So thank you so much, doctor, for your valuable guidance to us, sir. I also thank to all the participants for joining today's webinar and making this session successful. So in the end, I say stay healthy, stay active, and take care of your blood pressure. Thank you, everyone. Thank you, sir. Thank you so much.
हाँ
101 ਵੀ ਓਵਰ ਹੋਏ ਸੀ.
अच्छा
ਕੁਝ ਨਾ ਪੰਜਾਬੀ ਚ ਵੀ ਕੁਐਸਚਨ ਪੁੱਛੇ ਹੋਏ ਆ.
हाँ फिर सारे पब्लिक
ਨੇ ਨਵੇਂ ਜਿਹੜੇ ਡਾਕਟਰ ਤਾਂ ਫਿਰ ਮਾਪਣ ਦਾ ਸਹੀ ਤਰੀਕਾ
सही तरीका है एक और
ਪੰਜਾਬੀ ਚ ਲਿਖਿਆ ਹੋਇਆ ਕਿਸੇ ਨੇ.
Rohit,
ਆਡੀਅנס ਲੋਕਲ
Rohit,
ਲੋਕਲ ਬੂਸਟ.
Rohit, we are still live. Please wait.
Yes.